Hello, I'm Dr. Jewel Mullen, Principal Deputy Assistant Secretary for Health for the United States Department of Health and Human Services. It is my distinct honor to welcome you to this HHS National Minority Health Month Twitter Town Hall. The theme for National Minority Health Month is Bridging Health Equity Across Communities. And throughout the month of April, HHS and the Office of Minority Health will highlight the work in communities throughout the country to reduce disparities in health and healthcare. Whether that work is in education, employment, transportation, justice, or community development, it is helping to build stronger and healthier communities. As a nation, we pay a staggering price for disparities in health, in both the well-being of individuals and families, and in economic costs. One reason we can all be optimistic about our ability to achieve health equity is the commitment of organizations and advocates working hard at the community level. Their work is vital to our mission and touches lives in every corner of the country. We thank them for their work, and we thank you for being a part of this Twitter Town Hall. Again, welcome.
What makes a healthy community?
To me, a healthy community starts with good and affordable housing.
A community with good jobs.
With good schools.
A healthy community is a way I can walk.
With access to nutritious food.
A community where our kids feel safe.
Mero Justo Samudai, community like mine.
Mi comunidad.
My community.
My community.
To not a dying way.
My community.
It's communities like mine.
Like mine.
Like mine.
As we celebrate National Minority Health Month, it's clear that bridging health equity across communities is more than just a theme. It is what drives the mission of the HHS Office of Minority Health and the commitment of countless organizations, leaders, and workers on the front lines who are striving to improve health in their communities and neighborhoods throughout the country. Today, we are proud to share just a few of their stories.
What can you do? We put together this task force that started in 2010 with 50 individuals and organizations and has grown up to 880. And we advocate for the professionalization of the community health workers. We have over 573 community health workers certified in the state of Florida. We take a look at Florida, and it could be a microcosm of what is going to be happening in the rest of the United States with the increased numbers in diversity, not only ethnicity, but also gender identification, disability. We have a chronic disease like diabetes and cardiovascular disease. We have obesity rates, but also we have a lot of incidents of cancer. We also suffer from the HIV epidemic. We're collecting data on seeing that shows the impact that community health workers have by teaching the community how to do better nutrition and better food choices. Also helping them find ways to become more physically active, assisting parents with their children and their growth. All community health workers, to some degree, there are pillars from which to build health equity.
Pathway, police and approach through health, wellness, and youth. The Pathway program, we're trying to make sure that we provide programs, provide opportunities for the community and youth, specifically Black males ages 10 to 18, the ability to access health education, health services, and also be presented with opportunities to meet and have dialogue with police. The police department create dialogue between youth and police, where they can build interpersonal communications with each other. Our youth have opportunities to tap into services like tutorial, GED. They can actually get their degree here at the center. We're trying to make sure that we provide the ability to access health education, health services, and at the same time, let's talk about some of those health issues that maybe add to the problem. We feel as though if you tie all those components together into a seamless connection of services and programs and activities, we're going to be able to combat some of the things that lead to criminal behavior. That's the main objective of Pathway.
We serve over 3,600 clients every month, and we speak over 17 different languages. And so in the city of Atlanta, or in the metro Atlanta area in the state of Georgia, about 50% of our communities are limited English proficient. When we do our work, we make sure that our programs and our services are in different languages. We make sure that our staff are bilingual or multilingual. We want to make sure that people have meaningful access and they can attain their highest potential for health. For our communities, language is one of the big barriers. We have our English program, and these classes are often sliding scale. They're free, really helping and targeting low-income and limited English proficient communities.
Do you have children?
We serve all generations here. We have, first generation, the 1.5s, who came here when they were young. We have the elder or the senior generations. We have youth program. We have the working adult population. We have nurses and doctors. We have medical providers that will come into the space to provide the education in language. We have interpreters and translators on site. I would like to think that CPACS is one of the best practices here in the Southeast. We are the only shelter of its kind that serves the immigrant and refugee communities in multiple languages. We're also influencing how the family is accessing programs and services, especially around health. We're saving lives.
It is truly exciting to see all the good work underway in our communities. This National Minority Health Month, we salute all organizations, leaders, staff, volunteers, and advocates working to make their communities healthier for everyone.
Good afternoon. I'm Carol Jimenez, Acting Director of the HHS Office of Minority Health. And those are impressive examples of the amazing work happening in just a few communities in the country. As Dr. Mullen mentioned, our focus for National Minority Health Month is on the important strides being made at the community level to advance health equity. For the Bridge to Health Twitter Town Hall, we will be showcasing the work of several OMH partners, people who are helping to shape their communities and are making a difference. We know that it's impossible to tell the story this afternoon of every organization and person working to advance health equity. But the people we will hear from today represent the many thousands who work every day to improve the health and lives of racial and ethnic minority populations, who are less likely to get the preventive care needed to stay healthy, less likely to receive quality care, and more likely to face poorer health. Many community-based champions for health equity are forming new and innovative public and private sector partnerships and initiatives that make their work more effective and their impact unmistakable. I know you'll enjoy hearing from some of our OMH partners this afternoon and will be as inspired by their work as I am. But before we get started, I want to extend a special thank you to Dr. Yanira Cruz, the President and CEO of the National Hispanic Council on Aging, for moderating our town hall. Thank you for joining us.
Good afternoon. I'm Dr. Yanira Cruz, President and CEO of the National Hispanic Council on Aging, the leading national organization working to improve the lives of Hispanic older adults, their families, and their caregivers. It's a pleasure to welcome you to the Bridge to Health Twitter Town Hall, hosted by the U.S. Department of Health and Human Services Office of Minority Health. Thank you for joining us for National Minority Health Month from Washington, D.C. We will hear firsthand from organizations doing work across the country at the community level to help achieve health equity. These stories are ones of dedication and passion from those on the front lines in improving the health of our communities. Federal agencies, national partners, grantees, and community-based organizations join the HHS Office of Minority Health to build bridges to help end disparities in health and healthcare. These bridges extend beyond public health. They focus attention on the indirect social and economic conditions in which people are born, grow, live, work, play, learn, and age. By addressing the social determinants of health, we can strengthen the foundation upon which better health is built. And by working together across sectors, we can help reduce health disparities and advance health equity for everyone. We encourage you to chat your questions using the hashtag #BridgeToHealth as we hear more about the impact these individuals and their organizations are making in the lives of everyday Americans. Joining us is Cheryl Boyce, one of the first and leading champions in health equity at the state level. She served on the Ohio Commission on Minority Health when it was formed in 1986, becoming the first state agency in the country created exclusively to address health disparities among racial and ethnic minorities. That commission was a critical partner in the efforts needed to carry forward the recommendations of the report of the Secretary's Task Force on Black and Minority Health, also known as the Heckler Report. In 2010, she retired from the commission as its executive director. Today, she works as an independent public health consultant. Cheryl, thank you for joining us.
Thank you for having me.
Of course. All right. So Cheryl, it's fitting that our first discussion today is with you. As everyone knows, the theme for National Minority Health Month is bridging health equity across communities. We know that state and agencies play a significant role in the health of local communities. Tell us about your start in health equity and what you consider to be some of the most impactful strategies state agencies have employed to address health disparities.
Well, I think my first foray into the world of health disparities was the fact that I grew up in East St. Louis, Illinois, at the wrong end of the health food chain. My family did not have money for us to have health insurance. In fact, my mother was never insured until she qualified for Medicare. And so without seeing the data, without knowing what people in health said, I could see that people in our community were dying prematurely from preventable diseases and conditions. So when I went away to school, I ended up majoring in health education with the intention of going home and sharing information and working in the community to improve his health status. But it didn't take me long to recognize that there was such a thing as public policy, and that policy determined who got health, how they got it, how much it cost. And so I decided at that point that I really wanted to work in health to try to resolve these problems. We then had a state representative in Ohio, Representative Ray Miller, who sponsored the creation of the Governor's Task Force at the same time that the work was going on with the Secretary Task Force here in Washington. And out of that came the Commission on Minority Health. And the concept was one that we got from the community. We had done hearings all over our state where more than 2,000 people came and shared their experiences and convinced us, not that we needed much convincing, that the community is a significant part of the answer to this if we respect the community, if we engage the community in a meaningful way. So as we created the Commission on Minority Health as a freestanding state agency, we promised the community their voices would always be heard. And so at every point along the way, whether it was policy or funding or grants, the community was engaged. So we did demonstration grants. We funded culturally sensitive programming that the system would have never given the chance to show the impact of it. And we figured if those programs succeeded in the community and the community enjoyed better health status, that the system would then embrace these culturally sensitive and specific programs. So the state level can do that. They can open the door to allow the community to do what it does best for itself. The answers do not lie in our hallowed halls of academia alone. There are many, many answers to these problems that reside in the community. Another thing that's been done at the state level is trying to create infrastructure for community-based services. People want to give grants and act as though just putting in a few dollars will resolve these long-standing problems. And many community agencies work tirelessly but aren't connected to any infrastructure. And so there have been the proliferation of state offices of minority health who are really critical links between OMH and the communities that we all want to serve. But the state offices act as translators back and forth between these entities. And so I think opening up the doors for participation in policymaking, funding decisions, and everything that has to do with health is an important role for the community, and the states have afforded them that opportunity.
Mm-hmm. And what are your thoughts around engaging community on the topic of health equity?
Yeah, I think that the community has been engaged. The community sometimes doesn't use the same language, but the community knew there was a problem before the system knew that there was a problem. And so I think that one of the strategies that's really important is for the community to be engaged in a meaningful, respectful way. And I'm going to say that over and over, because the fact is, I think people go in sometimes and simply meet with the community and want to use the fact that they met with them to co-sign whatever it is that they're doing. The community needs to see the translation of what they want in the work that's being done. And so anyone who says they're doing community work that doesn't have community participation in a meaningful way, a mutual way, is simply dressing on something that doesn't exist. The community participation is very important, and the community wants to be engaged.
Cheryl, what advice could we give our next generation on how to address health disparities today?
I would hope that young people who are thinking about careers in allied health and medicine or any part of the kingdom that pertains to health would study to show themselves approved, that in addition to whatever they're being taught in the books, that they would go out in the community and learn from the community in terms of values, practices, belief systems, because all of those things are really important. The fact is, it doesn't matter that we provide services if the services don't result in improved health status, and we will never truly have improved health status unless we understand the cultural context in which these communities live. And so I would encourage students to, every opportunity they have, to volunteer in community-based organizations, to find mentors, and to learn. You know, if we live in a multicultural society, healthcare must be multicultural too. And we can't just learn it in one way and think that we're going to benefit everybody.
Thank you, Cheryl, for that inspiring historical perspective that shows how your work and the work of other health equity leaders paved the way for what we do today. If you're just joining us, welcome to the Bridge to Health Twitter Town Hall, hosted by the HHS Office of Minority Health. I am Dr. Yanira Cruz, President and CEO of the National Hispanic Council on Aging. We are a strong voice dedicated to promoting, educating, and advocating for research, policy, and practice in the areas of economic security, health, housing, and leadership development. We thank you for tuning in to hear informative and inspirational stories of the efforts taking place across the country to help reduce disparities in health and healthcare. We also encourage you to help raise awareness on health equity in America by visiting the National Minority Health Month website at minorityhealth.hhs.gov. Here, you can find out more about upcoming events and download resources to promote in your community on issues of health equity and social determinants of health. You can also access sample social media messages and add an event you are organizing to the National Minority Health Month calendar of events. Up next, to tell us how programs that address the social determinants of health play out on the local level is Lauren Vague, Business Development Manager of Uplift Solutions. Uplift Solutions is a national nonprofit consultancy that supports food businesses, governments, nonprofits, healthcare systems, and more to create access to food, access to health, and access to capital in underserved communities. Uplift Solutions believes that supermarkets can be holistic community hubs to anchor underserved communities and ensure consistent access to food, health, and capital. Welcome, Laura.
Hi, thank you for having me.
Thank you for being here. Laura, tell us a little bit about your partnership with the Southeastern Health Equity Council, the work you're doing with the Fresh Food Financing Fund. How does that access to capital become a social determinant of health in your work?
Sure. So essentially, access to capital is a social determinant of health because there's a lack of access to grocery stores. The way that those are connected is that, excuse me, is that it takes money to build a grocery store, right? They're expensive operations and they're important operations. And if you don't have the capital to finance a grocery store is never going to open. And when we're looking at particularly the southeastern region, that RHEC, there are 1,441 food deserts there. And that's a lot of places for there to not be access to food, which is related to access to health, to chronic disease, to comorbidities. And so therefore having capital to finance grocery stores to create the access to food then creates a more equitable ecosystem.
Mm-hmm. Mm-hmm. Let's talk a little bit about food deserts. Mm-hmm. How prevalent are they in the United States, and what's the impact of bringing a grocery store to a community?
Sure. So according to the 2010 census and USDA food desert map, there's over 6,500 food deserts in the United States. And food deserts don't discriminate. You can find them in urban communities and in rural communities. In urban communities, it's a 1-mile radius with lack of access to fresh and healthy food. In a rural community, it's a 10-mile radius without that access. And it really is a problem that affects the community as a whole, and therefore it needs to be addressed holistically. It creates a lot of chronic disease. It creates a lot of economic distress. And so the way that we look to address is really community-based. Through our work at Uplift Solutions, we work really in 4 primary program areas: access to food, access to health, access to capital, and then we have a workforce discipline as well. And it is so pervasive in the way that the problems are connected, and it just is something that not only you see on the ground, but you see in the larger macroeconomic landscape of the United States.
Mm-hmm. And what's been interesting work you're doing, what's been the response from the community, from businesses to consumers in the areas where you are?
Sure. So I think that, we live in a world where, we're a capitalist country and businesses are important, but community is important as well. And so the reaction from business has been that if we can teach them how to create an equitable, sustainable business model, which we can, given the feasibility studies that we do and the technical assistance we provide, the reaction from them is, oh my gosh, I didn't know I could make a sustainable business in a low to moderate income area like this. And the reaction of the community is really increased ownership and trust in a business in their community and feeling like they've had a need addressed because they need fresh food. We all do. And when those stores are able to open, they feel like they've really been listened to and heard.
Impressive work. Thanks, Lauren, for bringing the issue of food deserts full circle. Nutrition and food security have long been understood to be social determinants of health, but your story of the Fresh Food Financing Fund stresses the importance of access to capital in bringing fresh foods to underserved communities. Thank you for joining us for the National Minority Health Month Bridge to Health Twitter Town Hall. On behalf of the U.S. Department of Health and Human Services and the Office of Minority Health, welcome. If you would like to help support our efforts in raising awareness on issues of health equity, we encourage you to sign up for the National Minority Health Month Thunderclap on Friday, April 28th. On this day, everyone who signs up will send out a message that tells their followers that by working together, we can end health disparities in every community. You can also help promote the Thunderclap throughout April by visiting the National Minority Health Month website at minorityhealth.hhs.gov and sharing the downloadable social media image with your followers. Our next story comes from Dr. Sela Panapasa, currently a faculty research scientist in the program for research on Black Americans at the University of Michigan's Institute for Social Research. She is the principal investigator for numerous projects, including the Pacific Islander Health Study, which was funded in part by the U.S. Department of Health and Human Services, Office of Minority Health. This study, completed in 2012, provides the first representative epidemiological study on health and healthcare utilization of two Pacific Islander subpopulations, Samoan and Tongan, including adults and adolescents residing in California. Sella's work is helping us understand more about the health and healthcare needs of subpopulations, which is a critical piece in improving the health of the nation. Thank you for joining us. Thank you for joining us, Sella.
Thank you for having me.
So, public health is heavily dependent on data. I'm interested in what drew you to explore issues of data collection and how to unmask the disparities that exist in underserved AAPI populations. How are these nuances shifting the way people think about public health strategies at the community level?
So my work began as an interest in data began as a graduate student, where I realized that data on Native Hawaiian and Pacific Islander populations were inadequate, as prior to 1997 they were aggregated with Asians and reported as Asian Pacific Islanders. Thankfully, in 1997, as a result of the Native Hawaiian and Pacific Islander community efforts, the Office of Management and Budget separated or the Asian Pacific Islander population racial category into two categories. And since then, the Native Hawaiian Pacific Islander population became a distinct racial category. With that said, it is important to note that this is a very diverse population in culture, in language, in its historical relationship to the U.S. Government. So what's so unique about this population is that you have a indigenous population as represented by Native Hawaiians. We also have migrants from the U.S. associated Pacific Island country nations and immigrants from the independent Pacific Island countries. So with this rich diversity, unfortunately the data on this population was still inadequate, and they were invisible as a small, hard to survey population. So the need to be able to elevate and improve data on such population was warranted, and that led to further action with the support of the community, advocating for better data on this population, and recognizing that, you know, a one-size-fits-all does not apply, and the importance of disaggregating data so that we can better understand the needs, the issues, and concerns of our diverse racial population.
AAPI populations are indeed diverse. So
very diverse indeed.
Yeah.
And hence the importance of disaggregating data so we can better understand.
Yeah.
The
terrific. Terrific. So at first blush, it seems that you're working on just on data, but what's the impact at the individual level in the community?
Thank you. So at the individual level, it's about elevating the voice and giving face to a segment of the population that has for too long been overlooked because of the lack of good data. And I think ultimately, if the goal is to achieve health equity, eliminate health disparities, that is the, it is the communities that are going to bring about that change. And until we understand what the issues are and what the disparities are, we will continue to lag behind other groups. So I'm hoping that the evidence from the study will be translated and shared with the community so that it can inform their efforts and help guide future interventions.
So as we look to the future, speaking of the future, what potential do you see for data to help us address major public health challenges in our society, particularly for diverse segments of our demographic?
So I would like to add that data on small, hard to survey, hard to reach population is very significant. It will help inform our future research, practice, and policies. And it's really important to understand what the needs are of these small, hard-to-reach populations. And, small populations matter too.
Absolutely.
And in order to help accelerate our efforts with health equity, they too deserve, I think, good quality data moving forward.
Absolutely, absolutely. Great work you're doing. Thank you. Your work in data collection and the work of others like you does this country a great service. The more we know about our increasingly diverse communities, the better we can create solutions to help further close the gap on health disparities. Thank you, Sela. Thanks for tuning in today as we hear stories from around the country about the health of our communities and the programs making a difference. If you'd like to engage on topics of health equity, like the ones we are discussing today, we encourage you to participate in other virtual events taking place with our partners. On Tuesday, April 25th, from 2 to 3 p.m., NIH's National Institute on Minority Health and Health Disparities will host a Twitter chat with other federal partners on the topic, Understanding Social and Environmental Determinants to Bridge Health Equity. You can follow their event at #HealthEquityChat. Here with me now to further the connection between data and the health of the community is Jeffrey Caballero, the Executive Director of the Association of Asian Pacific Community Health Organizations. In this capacity, Mr. Caballero advocates for programs and policies that increase access to high-quality, comprehensive community healthcare services that are culturally and linguistically appropriate. His work experience includes a number of fields, from grassroots organizing, health education, to bone marrow transplant and primary health care. He has played leading roles in several national initiatives to reduce health disparities, including the protocol for responding to and assessing patients' assets, risks, and experiences, PREPARE. This was a national effort to help health centers and other providers collect the data needed to better understand and act on their patients' social determinants of health. Today, we will hear more about these efforts. So welcome, Jeff.
Hello, Yanira.
It's great to have you here.
Thank you for having me.
Thank you for all you do. So tell us more about the project APCHO. You've partnered with the National Association of Community Health Centers, called PREPARE for short. How does this tool help address disparities in health and healthcare?
Sure. PREPARE stands for Protocol for Responding and Assessing Assets, Risk, and Experiences of Patients. It's a multi-year project between APCHO, the National Association of Community Health Centers, the Oregon Primary Care Association, and the Institute for Alternative Future. It involves the development of a tool to help providers understand the upstream drivers of to improve outcomes and reduce costs.
And how do you convince payers to see the value of PREPARE?
Well, Prepare is aligned with Meaningful Use and ICD-10, which payers utilize for many of their critical billing and compliance issues. But payers are already using their own existing tools to identify and develop risk adjusters for communities of color. But with the use of Prepare, payers will have a better understanding of the factors that are contributing to these upstream, to address upstream issues and factors that are contributing to poor outcomes.
As far as technical assistance, do you offer technical assistance to health centers and other social service organizations that are, interested in implementing Prepare?
Well, the Prepare tool is currently, the Prepare Implementation and Action Toolkit is currently available free online. And it comes with resources, best practices for those who are interested in implementing the tool. But in addition to that, there are also templates for the 4 most common electronic health record systems in community health centers, and that's NextGen, eCentricity, eClinicalWorks, and Epic. And in addition to the materials that are online, HRSA is also providing support to develop community learning teams across the country so that it can leverage peer support groups of folks who have had experience using Prepare. But last but not least, APCHO and other Prepare partners are actually currently engaged in a 3-year effort to engage primary care associations and health center controlled networks in 32 states over the next 3 years.
Excellent. Timely work you're doing.
Yeah.
Timely work. Thank you so much. Thank you, Jeff, for telling us more about the tools health professionals and others now have to help identify the underlying causes of disparities in health and healthcare. Social determinants of health are a key focus of this year's National Minority Health Month observance. By collaborating across sectors such as health, education, justice, housing, transportation, nutrition, and employment, we can improve living conditions in communities and help individuals live longer and healthier lives. Stories that we have heard highlight the work of the HHS Office of Minority Health and its partners that serve as bridges between the sectors that impact health. If you want to help promote the connection between health and indirect social and economic conditions in which people are born, grow, live, work, play, learn, and age, download and share these social media images from OMH. They help bring attention to the forces at play when it comes to improving the health of our communities. You can find them on the National Minority Health Month website at minorityhealth.hhs.gov. Well, next up, we'll hear from an individual who is leading efforts to address the disparities in at-risk tribal youth. Brandon Frechette is an enrolled member of the Menominee Nation, where he continues to work in issues of health equity. Brandon has strong ties to his local community, having served as the Menominee Indian High School varsity baseball and basketball coach, substitute teacher for the Menominee Indian School District, and youth advocate for the Menominee Indian Tribe. His investment in the community now includes serving as the coordinator for the Menominee Youth Empowerment Program, which is funded by the U.S. Department of Health and Human Services, Office of Minority Health. This program provides opportunities for youth to learn skills and gain experiences that contribute to more positive lifestyles and enhance their capacity to make healthier life choices. Welcome, Brandon, to our conversation today.
Poso and Wawanan for having me.
So let's get started here with some questions. What are some of the biggest challenges facing Native youth today, and how has the Menominee Youth Empowerment Program addressed these challenges?
I'd say, speaking for our people, the Menominee people, came at a time in the 1950s what was referred to as termination, where we were no longer recognized as we're no longer a federally recognized tribe. That came at a very tough time for our people. That forced a lot of our enrolled members to seek unemployment off the reservation. With them high rates of unemployment came high rates of poverty. So I think there was a lot of loss of cultural identity, who we are as Menominee people, and I believe we still suffer from some of them things today. I think you look at when we were, I guess I'll refer to restoration as when we got recognized as a tribe again in the 70s, and I think we still are recovering from that, the trauma that we've been through. You look at the boarding school era, what our Native people have been through. The Native people were stripped of their language, told that they could no longer speak their language, practice their ways of life, and just everything changed with their ways of life, and then changing back and trying to regain your culture and your cultural identity was a hard time. Historical trauma being another part of that. So I think them are just factors that our children are suffering from today, that personal identity, not knowing who they are personally, and their cultural identity. So them are some of the factors that our youth are struggling with today, and that's what our program helps to do, the Menominee Youth Empowerment Program, to help to try to strive for that resiliency. And we've been doing a good job so far. Our staff, we have a great staff.
Excellent. In your program, you talk about a sense of belonging. And what impact has this sense of belonging concept had on your students?
It's had an enormous impact. I'll go back to a model that we adopted in our program, referred to as a Circle of Courage. And Circle of Courage is a positive youth model that says to be emotionally fit, every youth needs a sense of belonging, independence, generosity, and mastery. And belonging is the one that we've seen the most impact in our students. When we first started the program, our students really weren't too sure what to expect. I mean, this was a big program that was just starting. We've some examples are we've had some students that were steering in the directions of gangs and going in them directions. And one thing I've learned in the youth work is that when any youth that join gangs is because they don't have no sense of belonging, whether that be at home or that be with their peers at the school or wherever. And belonging is what they get with our program. So we actually don't see that. I mean, we have some of our students. One of them will be a valedictorian this year. We have a nationally ranked boxer. We have most of them are at the top of their class, and our staff does a really well job of gaining that trust, and that didn't come easy. We had to earn that from them students because they were kind of had their guard up. So when we gained that, we've seen enormous results.
Mm-hmm. Thank you. Thank you for that work, Brandon. And I'm wondering here, as I hear you talk, where do you go from here? Where do you go from here, specifically thinking of your students and your tribe? What's next in this work?
What we're trying to do is we're trying our best to, with our grant writers and the PI of our program, we're doing everything we can to try to secure more funding, because we've had just an enormous support from our community on the program. We've had teachers that come to us. We've had community members and even tribal leaders that talk about the impact that our program has had on our students. And so we don't want to see that end. We want to try to do everything that we can do to secure more funding. The overall impact that it had, I mean, we definitely want to try to continue what we're doing with the Menominee Youth Empowerment Program.
Mm-hmm. Amazing work and so important, very timely. Thank you, Brandon. We appreciate all that you do to ensure that our nation's tribal youth have the tools needed to have a bright and successful future. Brandon is one of many of what we call health equity changemakers. Aside from the ones we heard from today, the HHS Office of Minority Health has a series of spotlights on people like our guest today who are making an impact on their community. To view videos of other changemakers, visit the OMH website at minorityhealth.hhs.gov/changemakers. And so here with me now in the HHS studio is Dr. Paula Papanek. As the founder director of the program of exercise science in the Department of Physical Therapy at Marquette University, Dr. Papanek has been teaching and training exercise physiologists for over 20 years. Over the last 15 years, she has been involved in community initiatives directed at exercise and wellness in both geriatric and youth populations. Dr. Papanek served as the principal investigator for a U.S. Department of Health and Human Services Office of Minority Health Empowerment Program grant project, where her role was to direct the fitness and wellness testing of youth within the program targeting healthy behavioral change and academic success in the Milwaukee area. Thank you for joining us today, Dr. Papanek.
Thank you for having me. I'm honored to be here.
Great. So let's get started here with some interesting stories you have in the work that you're doing. Let's start with a description of the community you serve in Milwaukee and the work you've done with youth through the Marquette University in your region.
So Marquette University is a Jesuit school where our philosophy is one of service, not to, but with others. And so it was a natural relationship when the United Community Center of Milwaukee, which is actually 2 miles away as the crow flies, from our campus, came to us and approached us and said they're looking for an academic partner to help work with them on a problem that they had in their children. And that problem was obesity. And so we started this relationship almost 12, 13 years ago now, where they came to us as scientists and said, can you help us as a community? And that was unique for me. That was my first step into community engagement. And so we developed a beautiful partnership, and over the years we have evolved into one that said there has to be a way to translate data and real and science into the community that can affect and have real change. And my personal philosophy was that active and healthy children would be more successful academically. And what we developed was called a pipeline model, that we would start with children that were at risk for unhealthy behaviors, unhealthy lifestyles, and that when they came through our program, they would be academically, physically, mentally prepared to be successful high school students. And my own personal bias is that they would then be more successful at getting into more rigorous universities, and that we could literally break the cycle of poverty that's in our community. Milwaukee is unfortunately a very segregated city. And so on the south side of Milwaukee, where Marquette is closer to, the Hispanic and the Latino community is there, and the high school graduation rate is low, less than 68. It's only about 68% of kids graduate from high school. 15 of the largest gangs in the city are located in this community. And so there are a lot of, I guess, pressures and challenges to being a healthy person, but more so to be a healthy youth. And so that's where we're engaged, is to try and break that cycle.
Terrific. It's clear that there's a very strong connection with your community. That's wonderful. What do you think it's making a difference in the kids that you're serving, the population you're serving? And what's their response? What's their response?
Well, anytime you start with a community engagement, there's a period of trust, and a lot of work has to go into building those relationships. And I'm very fortunate to have had the time afforded that we could develop these relationships, that we now have parents that look to us and that contact us and are asking us about the next program for their child that's coming up in the ranks. And so part of what we try to do is to get them to see that community engagement isn't one directional. It's bi-directional. And I think one of our great successes has been the incorporation of Marquette students, undergraduates, pre-professional students as mentors, so that the youth can see what it's like to go to college. They come to our campus, they can go to a class, we demystify the institution, if you will, of higher education with young people. You know, a college freshman or a college sophomore who thinks that they should volunteer. What we've seen is that they start volunteering, but very quickly they get bonded to these youth and develop relationships. We have students at Marquette who have gone to these kids' 8th grade graduation. And the 8th graders and the families have gone to Marquette students when these mentors are graduating. And so what's really important about community and engagement type of work, and particularly health-related work, is it breaks down barriers in both directions. Again, we're really only 2 miles away, but we could have been 1,000,000 miles away for what was not happening before our Youth Empowerment Grant. And so we are changing not just, I believe, passionately, not just changing the lives of these youth that we work with, but they are having an impact directly on the Marquette students and making them think about their future and how they can engage in their role in being a part of the change.
I really like this concept of bi-directional in terms of having impact on both ends, the kids and your students at the university.
It's been very powerful, and it's not just the students, but it's actually me.
Yeah.
This is not my profession.
Yes.
I got into
You're a
this.
physiologist.
I'm a physiologist,
That's right.
correct. And so I'm a trained physiologist. I came to Milwaukee to work with a very famous laboratory across the country, actually, and I'm trained in cardiovascular disease and in bone health. And so my love has been exercise and the impact that exercise has on bone or on your heart disease. But when this opportunity came up, I said, absolutely, exercise can be the difference for kids. But the impact that it's had on me has been quite profound. I'm grateful every day that I've had this opportunity.
That's great to hear. And do you see your mission being different today than, say, 20 years ago or back when you started your interest in physiology?
That's a great question. Unfortunately, probably it will have to do with funding. If I have access to funding, I would love to continue these programs. We're looking for ways to sustain and move forward with these because I think they're very powerful. I certainly have a great love for my basic science training, and what I try to do is use that training in a community engagement setting. So looking for facts, using quality assessment tools to demonstrate the power of this, that data can show the impact of change, that I have students, we have decreased the incidence of obesity by 28% and overweight by 26% in the first 3 years of our program, that we have kids that have gotten into a higher tiered high school because of this program. And so using the data as a trained scientist to evaluate impact, I think can demonstrate a return on investment, if you will, in a meaningful way. In our 12 years, during the time that we had kids in the program, we did not have a single teen pregnancy. All right, in a community where that's a problem. We have all of our kids that have been engaged in our program have graduated from high school. That's data that demonstrates power and impact. And so, I hope that I have the opportunity, to continue and to sustain this type of work because I think it has been life-changing for me, and I would like to continue.
Amazing, and such an important work you're doing. Thank you, Paula. We talk a lot about impact on the community, and your story really brings that point home. So thank you so much for what you're doing. As we heard from all of our speakers today, it takes a collective effort to make an impact in our communities. Organizations like theirs are building bridges that help make the high-quality education, safe neighborhoods, quality housing, reliable transportation, clean surroundings, nutritious food, and stable employment available to all Americans. If there's one thing to take away today, it is that health disparities impact us all, and we all must do our part. Through our collective efforts, working across sectors, we can build bridges that help us to achieve a nation where everyone has the opportunity to achieve their full potential for health. To learn more about these efforts, visit the National Minority Health Month website at minorityhealth.hhs.gov to sign up for OMH email updates, share information on your Observance Month events and activities in your community, and to download and share information on health disparities. And stay in touch with the latest by using hashtag NMHM17 and following us here on Twitter at Minority Health and Twitter en Español at Salud de Minorías. Thank you for joining us today.